Hello friends, I am Dr. Anurag Saxena, Head of Department of Neurosurgery at Manipal Hospitals, Dwarka. And in this video, we are going to discuss about a very common problem, cervical spondylosis, cervical stenosis, or any problem related to your cervical spine. Now, what does cervical actually mean? Cervical is a medical term for your neck. So any problem with your upper spine, especially the spine which is in your neck, the cervical spine, is commonly termed in layman terms as a cervical problem. Now, when we say cervical problem, spondylosis or spondylolisthesis or stenosis or any other problems, it actually means that due to age and regular wear and tear, or sometimes because of poor lifestyle choices, there are problems like slip disc or hypertrophy of the joints of your spine, or sometimes slipping of the vertebrae, or the vertebrae starts to slip on each other because of degeneration or excessive abuse or overuse of your cervical spine, and that leads to compression on the spinal cord or the nerves which comes out from the spinal cord. So cervical spine carries the spinal cord down. Also, it gives out nerves which goes to your hands on both sides as well as in the upper thoracic region. So whenever there is a compression on the cervical spine or spinal cord, you develop certain signs which we call as myelopathy in medical terms, which actually means compression on the upper cervical cord or the cervical spinal cord will lead to difficulty in walking, difficulty in balancing. Sometimes patients develop numbness and tingling in their hands, in the legs also. The things can start dropping from your hands. The sensation of hot and cold can go away. The hand grip becomes really weak. You are not able to tie or untie or unbutton your shirts, or it is difficult to start combing your hairs. There can be slipping of slippers from your feet. You can feel like you're walking on a cotton wool or like a mattress when you're walking on a hard floor. And this kind of symptoms are called as cervical myelopathy, which most of the time is age-related problem due to compression of the cervical spine. Again, it can be because of the disc or slip in the vertebra. The other problem which this disease can cause is the compression on the nerves, which actually comes in form of tingling or pain along the distribution of your hand. It can start with your fingers, or it can start from shoulder and go down all the way down. Now, these symptoms, if you are experiencing on a regular basis, the best thing is to go to a neurosurgeon and get yourself checked. Normally, an MRI is indicated in this kind of cases, where we can diagnose what actually is wrong with your cervical spine. The treatment largely depends from medicines, physiotherapy in severe cases, microscopic surgeries, sometimes minimally invasive surgeries to relieve the pressure from your spinal cord and your nerves, spinal nerves or your cervical nerves, to free your hands. Now, timing is of essence, because the later you come to us, the more damage your cervical cord or your spinal nerves have taken. It is difficult for them to repair even after surgery. So if you are diagnosed early, if you go to the surgeon early surgery or early intervention in terms of physiotherapy or medicines can help you to lead a normal, healthy life. Thank you.